Good evening, viewers. My name is Dr. Shola Akini. I'm a consultant gynecologist at True Care Fertility Clinic, Lagos. This evening, we are continuing our Feminine Health Talk series. The topic for this evening is uterine fibroid. Uterine fibroid. Uterine fibroid, I understand, is called aporimwa in Igbo, aporimwa in Igbo, and in Yoruba it is called Iju. In Yoruba it is called Iju. Now, this is a very important topic, and I hope that many of our female folks are online to listen so that we can discuss issues around this topic, and more importantly, they can ask questions and get information. I'll start by saying that fibroid, that the womb has 3 layers. The first, which is the outer layer, second, which is the middle layer, and the third layer, which is the inner layer. Now, the second layer is made up of muscle. It's actually called the muscle layer of the womb. Now, therefore, it contains muscle cells. And this is the layer that contracts when women are in labor and gives labor pain. Now, we do not, as doctors, we do not know the actual cause of fibroid. We don't yet know the actual cause of fibroid. But what we do know is that fibroid grows from the muscle layer, that is that middle layer that contains muscle. That is where fibroid originates from. Why it does so, also we don't know. But there are suspicions that this is as a result of a single cell mutation, which means an abnormal change in one single cell that cascades into the growth of fibroids. That is to say that the muscle cells, which are smooth muscle cells, there's a change which is abnormal that allows fibroid to grow. That is to say that the growth of fibroid is not under the control of the body mechanisms, and that is what makes it abnormal. Now, fibroid behaves like excuse me, onions or yam, if you may. They grow like tubers in such a way that once they get started, they have daughter growth. That is, there's a mother fibroid and then there are daughter fibroids. In which case, if you remove the mother fibroid or the mother onion and leave some little amounts behind, you can fibroid can actually grow from the remnants, that is the little amounts, just like onion will grow, just like yam will grow. When you harvest yam and you leave some parts behind, from the part you left behind, new yams can grow, and that's the way fibroids behave. And in terms of feeling, if you have a chance to have a feel of fibroid, how it looks like, it feels as hard as onions too. which why I like to use audio most of the time to describe fibroid. Now, how is fibroid dangerous? Not really, except that they have some consequences. And most fibroids are, by and large, fibroids are they are not cancer. They are not cancer. In the vast majority of fibroids, you don't have cancerous or cancer change. The incidence, however, of cancer in fibroid is about between 0.3% and 0.7%. What I'm saying, therefore, is that for the vast majority of cases, fibroid is not cancer. But then, in a very little percentage, fibroid can change from being non-cancerous to cancer. That percentage will translate to less than 1 in 1,000 cases. So there's a possibility that fibroid can transfer from being benign, that is non-cancerous, to cancer in that little percentage. How common is fibroid? It has not been documented clearly because fibroid largely is a disease of Black Africans. We know that it is rare to find fibroid before the age of 15 years in girls. It is rare to find fibroid before the age of 15 years in girls. And the commonest age range is between 24 and 44 years. And this happens to be the age at which women reproduce, that is the reproductive age group. So between the age of 24 to 44 years is the reproductive age group, and this is the age bracket at which fibroid is common. Now, like I said, between white and Black women, fibroid is 9 times more common in Black women, that is Africans, than white women or Caucasians. Fibroid is 9 times more common in Africans. Therefore, you probably would say that it's a disease of African women from the age of, say, 24 to 44 years. The fibroid is so common that when, as doctors, we perform operations on women, we've encountered fibroids in more than 50%. That is, half of women that are operated for other reasons, we find fibroids being present. And it is been postulated that by the time a woman is 50 years, the chance of fibroid is about 80%. That is to say that as you grow older, so also there's a possibility of getting fibroid. Like I said before, we don't know the reason, the cause of fibroid. We only can suspect, like I said, that we suspect that it's a mutation. But then there are factors that we have noticed that may be contributing to the development of fibroid. The first is, like I said, we notice that in some families, if your mother or your sister has had fibroid, it is not unlikely you are at a higher risk of having fibroid. That is, fibroid may be familial. Then we notice also, so you can actually say that if your mom has had fibroid, is it possible that you inherit it from your mom? That is a possibility. But like I said, we know it runs in some family. That is, people with family history of fibroids have a higher risk of getting fibroid. Now, we also know that between the age of 24 and 44 years, that is the age where hormones, women reproduce, they get pregnant, and during pregnancy there are hormone changes, new hormones, especially estrogen, which is the chief, estrogen and progesterone, which are the chief hormones of pregnancy. So hormones seems to be the fertilizer that enhances fibroid to grow. So the thinking now is that especially estrogen, that women who are exposed to estrogen may, if they are not monitored, may are the risk of fibroid. Some people have asked me on several occasions whether the food we eat contribute in any way to fibroids. The question about food is that we know that whatever you take in can upset your biochemistry, that is your body systems. But there's no clear-cut reason to believe that food does cause fibroid. People have suggested sugar, excessive consumption of sugar, excessive consumption of red meat. Of course, excessive consumption of anything is not good, but we do not believe, there's no documentation to confirm that food causes fibroid. How do we what are the types of fibroid? Now, doctors classify or talk about fibroid according to their locations. Remember, I said that fibroids grow from the muscle layer of the womb, which happens to be the middle layer of the womb. Now, from that place, it can grow outside to the outside layer of the womb. That is called a subserous fibroid. When it grows into the womb, that is into the inner layer of the womb, it is called submucous fibroid. Now, majority of fibroids are still confined largely to the middle layer. That is from where they grew from, originated from, and they are called intramural fibroid. Now, there are some other types of consideration, like fibroids may appear in the neck of the cervix. The neck of the womb, called the cervix, and they are called cervical fibroid. Also, in some occasions, which are far less common, you can have fibroids growing outside the womb. That is, they are not subserous, they are not intramural, they are not they are not submucosal, and they can appear in the adjacent structures to the womb, especially the broad ligament. All right, so this type of fibroid that is connected to the uterus or the womb by a stalk is called pedunculated fibroid. The thing about that is that because it is free and dangling, there is that possibility that it may twist around and cause a lot of pain, severe pain. That is pedunculated fibroid. Now, who are the people at the risk of fibroids? Who are the people at the risk of having fibroid? Now, in the society, like I said, looks as if fibroid is a disease of Africans. Like I said, in the ratio of 9 Africans to, that is 9 African women to 1 white woman. Now, second, those who have family history are at increased risk of having fibroid. The third are those people that are fat, obese women. That is, obesity is a risk factor for developing fibroid. Again, like I said, some women are exposed to hormones, especially estrogen, maybe during treatment and all that. If they are not checked, they may develop fibroid, or at least they act as fertilizer in the development of fibroid. Those that attained menarche, that is their first menstruation early, and then attained menopause, that is ended their menopause so late, that is early menarche and late menopause. The question here is that they then menstruate. It then means that they menstruate for a long time in their lifetime. Those people, because during this time they are menstruating, they have hormonal place, they have abundances of hormones and all that. Therefore, and like I said, hormones seems to be the fertilizer here. So if people menstruate for a long period, that is so many years, either because they started menstruating early in life or they stopped menstruating very late in life, they are more likely to have fibroid. Then there are some diseases that we have found to be associated with fibroid, especially severe diabetes mellitus and severe uncontrolled hypertension. All these people can work in a complex, this disease can work in a complex manner to cause fibroid. Remember that many people that are diabetic, many diabetics are also obese, that is, they are also fat. Now, what are the complaints? What are the complaints that, what would people complain that will probably bring you to the doctor, or what are the issues with fibroid? Now, the complaints that a woman that has fibroid would have would depend largely on the location of the fibroid, the size of the fibroid, and the numbers of the fibroid. By the way, I must add that in 50% of cases, fibroids, women with fibroids they have no problem. That is, there are no complaints. And they may just be identified accidentally, maybe when they are doing routine investigations or complaints for other reasons. I must also add that the nature of fibroids in Africans is a little bit different from those in white women. First is that they are bigger in Africans. They are bigger, they are more numerous in number, and of course the locations could be anywhere amongst the 4 or 5 locations that I said. So it is these are characteristics of the African type of fibroid: bigger and more numerous. Now, so what would a woman with fibroids complain of? The first thing probably is that there is a mass in the lower tummy, that is big tummy. Some will be big enough that you can actually press it and feel it. They normally feel hard and sometimes maybe irregular. Okay, so big tummy is one complaint. The second complaint is irregular bleeding. This irregular bleeding may be related, may come spuriously, that is, not related to your menstruation. And also, bleeding may come during menstruation and be heavy. That is, fibroids can make your bleeding to be heavy and prolonged. Now, we can also, if you are pregnant, you can also have irregular bleeding or spotting due to fibroid. The third complaint that is common is pain. Fibroid may cause pain, and this may be because of the fact that they fill the pelvis, or so they call tension pain. And like I said again, sometimes the blood supply may be compromised, and when there's shortage of blood supply, there's a type of pain called ischemic pain, and this type of pain also can happen in fibroid. When excuse me, with pedunculated fibroid, you can have a situation where the pedicle, that is the stem, is twisted around itself, and this causes a lot of pain also. Now, aside from menses and aside from those cases that I've mentioned, people with fibroid can also have pain during sexual intercourse. Of course, like I said, pain during pregnancy. You know, the uterus is already has already filled up the pelvic cavity. Now, if you add fibroid, that means that everywhere is filled up and there's tension all around. So, pain is one feature of fibroid that can that can happen in pregnancy. The one that doctors talk about, it's when there's a change in the fibroid such that it causes severe pain, and this is probably peculiar to pregnancy. Doctors call this type of condition red degeneration. That is, the fibroid has changed in such a way that it causes pain and in pregnancy. Now, aside from pain, irregular bleeding, big tummy, we also have infection. Doctors believe also that there is an association between pelvic inflammatory disease and fibroid. So infection also plays a big role in the complaints that somebody suffering from fibroid may have. Now, aside from pain, infection, irregular bleeding, and big tummy, then we have pressure symptoms. Remember that the fibroid originates from the uterus or the womb, and the womb is in the pelvis, and the pelvis is the waist area, and it's an enclosed space. Therefore, if there is a mass that is growing there, that is growing faster than what the pelvis can contain, there will be tension there. And then once this happens, there will be compression, especially of the blood vessels. And this can lead to certain consequences. Other neighboring organs, like the urinary bladder, can also be compressed. And this will all lead to symptoms. So you have a situation where, for example, if the fibroid is huge, as it is in some women in sub-Saharan Africa, it can compress on the colon, that is the small colon, the big colon, and even the stomach. And when it does that, it sits on the colon and can affect the way food digestion is happens. So with this, we can have constipation. That is, the patient is unable to go to toilet, to poo as usual, or because if the fibroid sits on the stomach, the acid from the stomach will not will accumulate in the stomach because they probably will not be able to pass down the next part of the stomach after the stomach for digestion. So an acid accumulation can lead to things like peptic ulcer, burning sensations in the chest. So these are then when the fibroid is so confined and sits on the bladder, that is urinary bladder, you can have difficulty in urinating, that is retention, or the urine may come out frequently, that is and urgently too. So, but you have a situation now where the bladder has been compromised because of the pressure, external pressure from the fibroid or the big uterus, and then giving frequent urination or retention of urine, that is inability to urinate. Now, because also there are blood pipes in the legs carrying blood towards the heart, if fibroids sometimes may sit on the big blood pipes, returning blood from the feet towards the heart. And when it does so, those blood pipes, there will be stagnation, or retention of blood within those pipes, so that these pipes are swollen and then they manifest externally. Once that happens, they manifest externally as swollen foot or varicose veins. That is tiny blood vessels that are crawling or around the feet because of congestion. So sometimes when this condition is severe, when you depress or put your finger on the legs, front of the legs, or on the feet, then you get depression. These are some of the features of fibroid because of pressure from within the pelvis. Now, perhaps one of the most common complaints that brings the patients to the doctor in our environment is the complaint of inability to achieve pregnancy, which is infertility. And therefore, how does fibroid affect infertility? Well, normally for a woman to get pregnant at ease, there should be orderliness in your menstruation, your ovulation. Then your husband must be okay in terms of the sperm quality, and fertilization must take place. And then after fertilization takes place, there will be implantation, and that is what we term pregnancy. Now, in terms of fibroid, if fibroid is present, it could cause irregular bleeding. And when a woman is bleeding irregularly, maybe for a prolonged time or during times that are unexpected, it is more difficult to plan or forecast ovulation, which means that planning for pregnancy is usually more difficult in patients with fibroid that are very symptomatic or troublesome fibroid. Second, if fertilization has even occurred, all things being equal, the baby has to be implanted in the inner layer of the womb. And then if the baby happens to be implanted on the fibroid, like you remember I said that fibroid is as hard as an onion. It's like dropping seeds on a rock. You don't expect pregnancy to continue. The baby dies off. When a woman manages to get pregnant, there is also increased rates of abortion, increased rates of pregnancy losses or pregnancy wastage. And like I told you, fibroid can cause pain during sexual intercourse. And of course, if a woman is running away from sexual intercourse, such a woman cannot, because of pain, such a woman may find it difficult to get pregnant. Now, so the problems, therefore, the problems in pregnancy are bleeding, pain, abortion, poor implantation. Then we know that if a woman gets pregnant, there is the possibility, increased possibility of what we call placenta previa. That is, the placenta may implant in the lower portion of the womb, because the fibroid has occupied the other places in the womb. So, and placenta previa is one of the major problems that can arise in pregnancy. Again, if the fibroid is occupying the lower portion still, the ability of the baby to jump around inside the womb during pregnancy, and especially during the last weeks of pregnancy, to make sure that the head is down so that the baby can come normally, may be hindered. That is to say that the baby may be presented abnormally, and that may actually lead to the doctor to make decisions for operative deliveries. This means that there is the risk of operation in women with fibroids is higher. Finally, one of the effects of fibroid is that if you put all what I've said together, fibroids cause ill health. If somebody is bleeding heavily because of fibroid, and this fibroid, the bleeding is on and off, which means that there's a possibility that the patient may at one point or the other experience anemia. That is shortage of blood. And if you experience anemia, you are going to get ill, you are going to feel sick, you are not going to be able to eat well and all that. So ill health, weakness, dizziness, all of this can be as a result of troublesome fibroid. Now, how do I know if I have fibroid? Well, you know whether, as I talk to you, I believe you are relating your body with what I've said. You have a mass in the lower abdomen or lower tummy, you have a big tummy, you can feel something hard in the lower tummy, you have heavy menstruations, you have irregular menstruations, you have painful menstruations, you have even pain during sexual intercourse, or your sister or your mother has had a history of fibroid and all that. You know that there is a higher possibility of fibroid comes into reckoning. And of course, nowadays, like I said, if you are experiencing difficulty in getting pregnant, this will make you think that could it be due to fibroid. This is one of the reasons why women come to doctors for help to achieve, to help them achieve pregnancy. Now, the best way now, the commonest thing we do now, and which is common around, is that there is availability of ultrasound scan. An ultrasound scan is very good and efficient in diagnosing or identifying fibroid. So, and since you can literally do ultrasound on a walking basis, if you find reasons good enough, if you suspect that you may be having fibroid, it will be worth your while to go to a good diagnosis center and get an ultrasound done. Now, having said all this, let's consider the remedies that are available. I know the issue of fibroid has generated a lot of controversies and confusion. in such a way that I would expect that by the time we finish our discussion, we'll have to take some of these questions and try and straighten them up so that we can have correct information. Now, what are the remedies available for treating fibroid? Now, the first is that once you have been diagnosed to be suffering from fibroid, then you need to see a doctor. The doctor would examine you and probably order for ultrasound scan, and that would confirm or that you have fibroid. And once you are confirmed, the decisions will be taken as to the modalities of treatment. How will the doctor treat you? But most times, doctors are guided by the type of complaint you have. Is it that you are bleeding heavily during your menstruation, which is dangerous? Is it that the mass is so big, the fibroid is so big now, and people start to say congratulations for your pregnancy when you know that you are not pregnant? That it is. Is it that you have serious pain? You cannot even enjoy sexual intercourse with your husband? Is it that you want to achieve pregnancy and you have a delay, and so on and so forth? So the decision of the doctor will be based on the type of complaints that is most serious and what you hope to achieve. Basically, the modalities of treatment falls into three categories: medical treatment, that is using drugs; surgery, that is operation; and then other intervention treatments. Excuse me. So, remember I said that for drug treatment, drugs will be directed or may be directed to the pain that you are feeling, in which case simple analgesics or very strong analgesics may be prescribed. It may be directed to correction of your bleeding, all right, in which case you may be given hormonal drugs that will tend to regulate and reduce your bleeding. Maybe shorten, for example, if it is during your menses, shorten the menses and also reduce the blood loss. Now, but basically, like I said, since hormones, especially estrogen, is what we suspect that is the chief culprit here. So many of the drugs that doctors use are those drugs that oppose estrogen, all right, at least reduce the action of estrogen, and there are many of them. So the doctor may give you drugs to reduce the to oppose estrogen and reduce the action or effect of estrogen, and therefore in an attempt to slow down the growth of fibroid or to shrink the fibroid. This is more importantly so if the fibroid is so big and surgery will be risky. So for some time, doctors may want to shrink the fibroid so that when eventually they go for surgery, the fibroid is sizable and then the operation is easier. So drugs may be given for some time, maybe 6 months, maybe 3 months, maybe 1 year or 9 months, for the size to be manageable, to shrink the fibroid to a size that is manageable. Also, if the issue is that you want to achieve pregnancy, doctors have two choices: either to give you drugs to control all the symptoms or the most prominent symptoms, or to perform operation. But this one, in this case, the objective will be to reduce the bulk of the uterus, of the fibroid. That is like a debulking. We remove as much as possible of the fibroids. This operation is called myomectomy, and I believe that this is very popular. Now, myomectomy or removal of fibroids or fibroid operation can be done by making a cut on the tummy or making a big cut on the tummy, which is what, especially if the fibroid is big, or making small cuts on the tummy if the fibroid is small, for example, maybe not more than a clenched fist in terms of size. Or it could even be done through the vagina. Now, but the objective is to remove as much fibroid as possible. Now, with medical treatment or drug treatment, the problem here is that the advantages are that, one, you get your immediate problem solved in most cases. Two, you also preserve the uterus. That is, you preserve the womb, and then you don't also go through the complications that may arise during surgery. So it's a way of preserving your womb, preserving your menstruation, preserving ovulation and all that. Now, but the drawback in using drugs for treating fibroid is that most times when the drugs are, the injections are stopped, the fibroids can grow back. So regrowth may be fast and rapid, So doctors need to usually consider all this when they consider the options available for treating your fibroid. The second modality is, excuse me, the second modality is surgery. For surgery, there are the intention is to remove as much fibroid as much of the fibroid as possible through myomectomy. But then, if you don't have a need, you have completed your family, and you don't have to, you are excuse me, you don't have a need for children, and the problem is much, you may want to consider removing the uterus, and this is like a permanent cure. Remember, in our previous talks, I said that the function of the uterus is to bear babies, that is menstruation, ovulation leading to pregnancy, and to carry the baby. Once you have completed your family, you should also consider, you may consider removing the uterus if the fibroid is troublesome or it is giving you some social concerns. Maybe it is very big and embarrassing you and things like that. So if the uterus is not removed, and say some of the fibroids have been removed, there is no way some little ones will not be left behind. And remember, like I said, fibroids grow like onions, and so there could be the remnants will grow back. So in this case also there will be recurrence, and recurrence of fibroid after operation is about 25%. So in about 3 out of every 10 women after surgery for fibroid, the fibroids will recur and they are back to the same problem. So aside from using drugs, aside from performing operations, we can also use some other ancillary, less harmful procedures. For example, we know that the fibroids grow because they have blood supply that carries all the things they need to grow. So the thinking is that if we reduce the blood supply to the fibroids, either by blocking the vessels that supply the womb, or tying the vessels, then the blood supply to the fibroid is reduced and the growth is slowed down. So we have some few procedures that doctors perform to reduce the blood supply to the womb and consequently the blood supply to fibroids, and these have worked for some people. Now, currently there are considerations about using modalities of ultrasound to destroy fibroid, but this is still relatively very new, and I believe that once this procedure is perfected, then many more women will benefit, especially those who do not want to undergo surgery and those whose fibroids have not yielded to medical treatment. Now, so like many women would ask, what can I do to help myself? Well, unfortunately, there's not much one can do. Fibroid is not something that you can prevent. If it grows, it grows. And like I said, I've listed or enumerated the risk factors. So being an African is a risk. If your mom or your family has previous histories, you are at risk. If you are fat, you are at risk, and so on and so forth. And it is not something you can prevent. So now, so what can we do? What can you do on your own? Aside from seeing the doctor, you can get simple analgesics for pain that are not severe. Some believe that if your pain is still moderate or mild, you can apply heat therapy, that is a water bottle, place it on your tummy, but be very careful so that it does not leak or the lid does not come off. So it tends to suit the pain of the fibroid, but of course it's not the severe type of pain. And exercise also has been adjudged to be beneficial in some women. Let me quickly address the issue of massage. In this part of the world, people resort to alternative medicine, traditional medicine and all that, including abdominal massage. That is, people massage the tummy or the womb manually in an attempt to cure or to reduce fibroid. This is not helpful, and it's proven to be futile. As a doctor, as doctors, we've seen cases of women who are diagnosed as having fibroids, and then they disappear for months. Doing a massage, and they come back. By the time they come back, the fibroids have increased in sizes, and the symptoms are more severe and more serious. So, massage is not effective. Again, is there any type of food that you can eat that would help in fibroid? The answer is no. There's no food that has been proven to be helpful in fibroid. Of course, see, if you go in this age and time of internet, you read about so many things that you can do. But medicine is about facts, and we have not seen any food that may help to treat fibroids or to reduce the size. Now, let me just finish by talking about the confusion between pregnancy and fibroid. Some people who have fibroids big enough, as if they're pregnant, go from one doctor to another, and in the belief that it is pregnancy and the baby is hidden. Some women will tell you that in their fervent belief that ultrasound do not pick such babies. That is not true. Ultrasound will pick the fibroid and pick the baby if the baby is there. But the whole essence of saying this is that you need to see your doctor, especially the gynecologist, who will make a proper diagnosis and proper treatment. So now we'll take some few questions. And can I have questions? So question, what can I do to stop fibroid from growing after surgery? From what we have said, fibroid is not something you can prevent. But like I said, there are certain risks that you can mitigate, that you can remove from your life via lifestyle or from your common practices. For example, if you are a fat woman, you can reduce your weight, which will slow down the rate of production of the hormones, especially estrogen, which will slow it down because, like I said, estrogen acts as the fertilizer, in producing in the growth of fibroid. If you are on drugs, especially estrogen drugs, you may want to discuss with your doctor towards changing the drugs because estrogen will encourage the growth of fibroid. But what I want to advise here is that since you cannot prevent fibroid, after the operation, do not waste time. For example, many women who are looking for the fruit of the wombs go for fibroid operation, and instead of going to the doctor for immediate treatment after the scar has healed, they will now spend the premium times waiting again. And while waiting, the fibroids then grow back. So by the time they get to the doctor again, the fibroid has actually grown back. So what I'm trying to say is that after such surgeries, please take decisive action on to resolve your infertility. There's no way to prevent fibroid, but there are ways, like I said, to mitigate your risk factors. Do fibroids shrink after delivery? Normally, during pregnancy, there are abundances of hormones, progesterone, estrogen, chorionic, gonadotrophin, and all those hormones are abundant. And these are hormones that are fertilizers for the growth of fibroid. That is, especially estrogen and progesterone. Now, after delivery, once the placenta is delivered, because the placenta is the harbinger of these hormones, once the baby is delivered and the placenta removed, then the source of supply of these hormones is cut off. And then, of course, there is no more fertilizer for the fibroids to go. So, after delivery, fibroids should normally shrink in size. Can fibroid cause delay in menstrual cycles? Fibroids cannot cause delay in menstrual cycles, but they can affect your menstrual cycles in other ways. They can make it to be irregular. They can make you to bleed heavily. They can make you to bleed for a prolonged time, but they cannot delay your menstrual cycles. I mean, they cannot, they cannot delay your menstrual cycles. Also, they don't have effect on ovulation, except that if they upset your cycle so much, you may not even know how to time your ovulation or when ovulation happens, and that means that getting pregnant or planning pregnancy may become difficult. No, we have to go that day. What's this? Oh, okay. My manager has just told me that we have to pause here. You can post some of your questions that have not been answered on my Instagram page or my Facebook page. I'll try my very best to get back to you with answers. Thank you very much for listening and joining. I hope you have gained one or two information. Like I said, the whole idea of doing all this is to provide information for women, and for women in turn to be able to use this information to their friends, to the benefit of their friends, to the benefit of themselves, their friends, their family, and their community, so that they are agents of information and change in their communities. I'll see you next time. Please stay safe. COVID-19 is real. May the Lord continue to protect us. Bye-bye.